Hello and welcome to the Society with Fatma Shaheen at PTB World. They say that the right of healthcare is not only anybody's fundamental right, but a society's success is also measured by how successfully it actually gives its different members this very right too. Having said that, when we do talk about healthcare, when we do talk about Pakistan's healthcare system, what is very important to then understand is that what are the most pressing challenges that Pakistan's healthcare system is currently faced with. And this is something upon which we'll be shedding light today. We'll not only be talking about the healthcare system generically, but we'll also be talking about the various issues that the common Pakistani actually comes across when it comes to accessing the healthcare system. In this regard, we'll not only be talking about the ever increasing communication gap between the patients and the physicians, but we'll also be delving upon the growing cases of malpractice and medical negligence in the Pakistani society too. When it comes to reforming Pakistan's healthcare, what we cannot ignore is the fact that we need to very actively embrace technology and AI. Although in this regard we have seen not one, rather various advancements being made, what we equally cannot ignore is that this does come with its own baggage. There are not one, rather various concerns being raised when it comes to using AI, that too in the healthcare industry in the country. What are those concerns? That is also another angle on which we'll be delving upon. Last but not the least, we'll be talking about the need for us to reform the healthcare system in a way that it is not affordable but equally accessible for every person in the Pakistani society. All of this today, that too with an extremely relevant panel. Let me introduce you to my today's panel. My first panelist for today's show is Muneeb Qadir. He's an analyst. Assalamu alaikum ji and welcome to the show.
Thank you.
Thank you for joining us. Alongside him, I have Dr. Muniba Kamran. She's a consultant developmental pediatrician. Assalamu alaikum ji and welcome to the show.
Walaikum assalam ji. Thank you for having me on the show.
Thank you for joining us. My third panelist for today's show is Dr. Kamran Qureshi. He's a health policy expert and he's also an aesthetic dermatologist. Assalamu alaikum sir and welcome to the show.
Walaikum assalam. Thank you for having me here.
And via telephone line, we'll be joined by Badr Khoshnood, who's a technology expert. Assalamu alaikum sir and welcome to the show.
Ji, thank you, Fatma. Really appreciate inviting me.
Now, to get the conversation started with you, Muneeb, when we talk about the healthcare system at a very basic level, we all understand it is faced with, well, not one, rather various challenges. But from an objective viewpoint, rather an objective bystander's viewpoint, which is of course very different from the doctors that we have on the panel here, what do you feel are the most pressing issues that we are faced with today when it comes to our healthcare system?
I believe that the first biggest issue is access to healthcare. Because if you do not have access to healthcare, your constitutional right to life in itself cannot be ensured. And we would, either advertently or inadvertently be violating the constitution itself. So it's the state's responsibility. And I think that the civil society also needs to be taken on into it to ensure that people do have access to healthcare. And there are many roadblocks and there are many obstacles to be able to have access to healthcare, which may range from economic circumstances to, the urban to rural divide or gender-based discrimination. So I think that addressing these issues is of the essence, because somehow, I mean, when I look at the statistics, I just looked at a report which says that more than 50% of people in the country don't have access to primary health care. So where are they going to go? That's an issue. Their life is under threat. So infant mortality rates have been on a rise. I believe that death rates, although life expectancy has increased, but when I talk about mothers who have just recently given birth to children, among them the death rate is very high, and that too in the rural areas. So looking at all these trends, it's I think a cause for immense anxiety, and also exacerbated by the fact that there have been natural calamities in recent times,
which adds to the healthcare
crisis,
burden at the end,
particularly the 2022 floods. I think, yes.
Right. But Dr. Sahaba, when we talk about this from the doctor's viewpoint, if you were to bifurcate, they are not one, rather various issues, starting from lack of communication or proper communication between the doctor and the patient. And we also see in cases more than one, cases of malpractice, medical negligence, and then lack of access, something which he said, but from the viewpoint of not being able to access technology too, because we can't ignore the fact that we all live in a digital world today. But then again, if you were to bifurcate this, what do you feel are the biggest issues, both in the urban cities as well as in the rural areas, because the dynamics, they completely change?
Well, if we talk about the urban cities, I think the most important problem is the busy lifestyles that we have. most of us, we are negligent of our own selves. We get so much busy in our daily lifestyle that we forget our own health. So it is important that we prioritize our physical health as well as mental health for that matter. And when we talk about the rural health area, I think the most important thing is lack of awareness, lack of appropriate health facilities, and again lack of the health centers in those areas and physical and medical expertise in those areas. There is a reluctance on part of doctors and healthcare providers to visit the rural health centers and far off area for various reasons. There are so many stigmas involved, there are so many physical and security threats involved. For example, when polio vaccinators, they were to vaccinate in those areas, they were very hesitant in going to those areas.
They were subjected to violence too.
Yes.
But then moving on, when we talk about this from the gender viewpoint, and you are the only female panelist on the show today, to what extent do you feel our typical socio-cultural norms, they in themselves hinder anybody's access to the healthcare system?
So when we talk about the gender aspect, it was a stigma to take our females towards a male doctor. Although despite there are lots of women who are getting admission in the medical colleges, it is a dilemma that 50% of the medical doctors who graduate from the medical colleges, they do not practice and they do not pursue their careers. So this is one of the reasons most of our female doctors don't get into practice.
On which I'll come to you, Dr. Saab. I would want you to respond to this, Dr. Saab, when we do talk about the most pressing problems that aesthetic physicians like yourself come across. A lot of times we see that perhaps people, they unnecessarily burden you with their unrealistic expectations to look good. But as an aesthetic physician, what do you feel are the most pressing issues that people like yourself come across? Because I'm sure your experiences would be very different from Doc Saiba's, who happens to be a child specialist.
Well, Fatma, I'd like to add to what was being said earlier.
Right.
You need to differentiate between basic healthcare and then you have to come on to the specialized healthcare and then you come on to procedures or fields like what I represent right now.
Right.
Because if you are talking about the basic healthcare, health is a right, it's not a privilege. And unfortunately, it's not like that. The other thing which my fellow colleague, she said, and I would second that thing, is the number of doctors being produced right now, how many are actually practicing, and whomever are practicing, what fields are they choosing as far as their practice line is concerned. Now, in the recent past, our field has gained a lot of popularity. Has it gained popularity because it's a pure medical field? No, it has gained popularity because of the reason everyone is taking a shortcut. And when you are taking a shortcut into something, you feel that it's easy money coming your way, then automatically that balance shifts. So if what my fellow colleague said earlier, that out of those females who actually do practice, which fields are they going into?
Right.
That's very important because if there are, it's right, okay, every doctor has a right to choose his or her own field, but why are we not making the other fields so attractive for them that they would pursue their career into neurosurgery, they should pursue their career into general surgery, into all other kinds of fields. So right now what is happening is people are just trying to go into one direction, which is a shortcut direction.
Right, so your point is noted. On which I'll come to you, Badr Saab, and here we must talk about this from the inclusion perspective, that too inclusion of AI in Pakistan's healthcare system. So as a technology expert, how do you over a period of time see AI being used, that too successfully, in Pakistan's healthcare system?
Technology largely is now impacting all non-tech sectors, both globally and of course in emerging markets and in developing countries like Pakistan. There are huge number of use cases where technology can really improve the ongoing status quo. Within the medical or the healthcare ecosystem, there are several use cases, and some of them are really important as well. So I think before I jump onto those few use cases, I'll quickly like to just highlight what AI is from a very layman's perspective. So artificial intelligence is backed by machine learning. Machine learning, in a very simple term, is as we teach our kids, as we teach our students, medical students, about different topics based on experience, and then we share how things can be improved, and then they go back to their labs and they do their tests, and then they do their internships and work with senior doctors and keep learning on the go. In the similar manner, we train machines and software, hardware and software, but that happens at a much faster pace. And that training happens based on existing records, which are already with the healthcare institutions, organizations, or relevant research organizations. And that, based on that data, machine learns what is right, what is wrong, what is to be diagnosed, and what are the possible treatments, and what are the use cases, and how and what these things will have impact, and what are the negative impacts, positive impacts, and everything. So keeping that in view, some of the important use cases are actually in the medical imaging category, where X-rays, MRI, CT scans, you have tons and tons of images, and a senior doctor or a radiologist or a professional has to look at every single small image and identify abnormalities and diagnose different problems or diseases like cancer or hairline fractures or other diseases. And that can be automated using AI very, very quickly with a lot more precision. And that is one big use case which is happening right now. So AI models are being trained on these data sets which are available with different institutions, so that they can quickly detect those things which at times even the human eye can miss. Similarly, on the back end, there are other use cases. For example, when we are developing new drugs, new medicines, you need a lot of research, you need a lot of iterations. That all can be now done using artificial intelligence and much quickly, as we saw in COVID that the vaccine was developed much faster. Similarly, the new upcoming drugs for unsolved diseases will come much faster with AI. So there are many other use cases, but these are a few which I thought are relevant and
And that's very rightly put by yourself, sir. And in this regard, it's also very pertinent to mention the fact that AI, in cases more than one, has also very successfully been used so as to work towards a more preventive disease burden model. But moving on, when we talk about AI's applicability, that too in the Pakistani local healthcare system, how relevant is it in our healthcare system? We understand the fact that yes, we have made that stride towards it, but can we, say that it has been beneficial in our local Pakistani context?
I think it's important to highlight some of the startups and medical healthcare, health tech companies working in Pakistan around these. So there are brands and companies. I'm sorry, I'm forgetting a few names here, but all of these new startups in Pakistan, some of them are, by the way, women co-founders, are solving some of the biggest healthcare challenges in Pakistan, and they are implementing or embedding artificial intelligence in all their problems. So that's how AI is helping solve some of the local problems. But I thought these startups need a mention and they should be highlighted. Thank you.
Right, sir, your point is noted. On which I'll come to you, Munib, and here we must talk about this from the regulatory viewpoint, because one issue which is often raised, and not only in Pakistan, world over, is the fact that how regulated is AI, whether it is being used in the healthcare industry, whether it's used in any other industry.
Yes.
So, as a lawyer, what would you say on that? When we talk about regulation of AI, is this something which has been prioritized, that too within the healthcare contours?
So the issues posed by artificial intelligence, I think they are still in their nascent stages. It's in very early stage, and I think that it's not just Pakistan, but the whole world is trying to grapple with both the advantages and here in terms of regulation, the disadvantages that may stem from the use of artificial intelligence.
Right.
So I think that is something very much in the pipeline, but currently patients or health service consumers, they are left very much at the mercy of general laws which regulate the medical profession. And when we speak about the general laws, you've got your Pakistan Medical and Dental Council, where you could take up an issue if there has been any medical malpractice.
And then we also have provincial
generally.
laws, Punjab level, and
Luckily,
Sindh level,
yes, and
right.
we've seen that happen. This is another phenomenon which has, I think, taken the front stage after 2010. But otherwise, you could rely on consumer protection laws generally, or in very grave cases where death results from medical negligence,
then that
or
would be,
medical
of course, in
malpractice.
the
So
Pakistan Penal Code,
and
right?
its various
But the
sections.
question then is, when we talk about this practically, Muneeb, how efficiently or effectively have we been able to implement these laws? Because a lot of times we do hear of cases on media and when otherwise where very clearly, healthcare professionals have committed malpractice or medical negligence. But
Yes.
are they put to task? Because there has to be this element of deterrence in the society for people to comply, with a certain standard.
So a lot depends on, for instance, when I'm talking about the Pakistan Medical and Dental Council, generally, what I have gathered from a lot of, I'm not saying all of them, but from a large section of patients who've had negligent treatment or who've suffered injury or perhaps even worse, death at the hands of negligent treatment, they haven't received replies.
Dr. Saab, I feel this is something which is equally true for people like yourself who must be coming across people having these expectations to make them look like their favorite celebrities, their favorite social media influencers too, because the burden of advertisements in such cases, that is too much. So considering you have international experience, you've earlier worked on in the UK, then you are working now in Pakistan as well as in Dubai, how regulated do you feel is our advertising industry, or rather how regulated do you feel should it be when it comes to tackling such issues?
If you look at the advertisement policies and everything, Instagram, Facebook, Snapchat, whatever medium you're using,
Right.
they're all in fact internationally governed.
Yes, social media platforms.
Social media platforms. And healthcare authorities cannot go onto these platforms and address this.
So it goes back to the doctors or the patients or the celebrities, like who would you vest this responsibility with? Because sometimes do you not feel the burden is too much because of these very aggressive advertisements?
The burden is not it's not just that because I'm going to get this in a certain amount of money and the other clinic is taking this amount of money, so I'll just go to that person. So would you trust yourself for going to some clinic or some other place which is not run by professionals? Maybe not. But there are others who would do that.
Right.
Then it's the influencers, then there is a big market from the TikTok, the TikTokers who would be going to any place. And then are they doing it just for the service or are they taking money to endorse that brand?
True.
Okay. Now, the population at large, they're very simple and innocent people. They believe anything and everything. And everyone wants some magic to happen.
Right.
See?
Which I think which in itself is very unfair on doctors like you, because then you have to bear that brunt of unrealistic expectations. But Dr. Saab, when we talk about the changing societal norms, and I think this is a question which would be very relevant to your particular field, we have seen that over a period of time there were diseases like HIV, like AIDS, and then mental health for the longest time was something which was considered to be very taboo. Do you feel that we as a society have been able to move past that taboo, especially when it comes to seeking aesthetic treatments, more particularly for men?
See, we are passing through that taboo, and we did discuss about all the things which were happening and how the society has moved forward from there and is still moving forward from there. It's not that it's completely moved forward. When we talk about my field as such, I totally agree that taboos are breaking, but it's taking a little while.
Right. But I do hope that we get through this soon. Dr. Saiba, I would want you to comment on this, but from the viewpoint of being a female doctor yourself. Now, a lot of times we see that women, especially those who belong to the rural areas, they perhaps might want to access reproductive health services, family planning services. But again, this is something which they might not be allowed to access, either because of financial constraints or because of the typical socio-cultural norms or the stereotypes that do exist. So as a female doctor yourself, how do you feel can we overcome this? Because clearly this is something which is at the end of the day discriminatory against women.
I think in this regard, media can play a miraculous role because as we can see, media has played its important role in breaking all the taboos. For example, breast cancers. For example, when we talk about polio campaigns, for example, when you talk about the reproductive health. So there were multiple ads that were being aired, and initially family would get uncomfortable when those ads, but now with the passage of time, as there is general increase in awareness and acceptance towards these issues. I think acceptance is there and we are moving towards that path.
But moving on, when we do talk about this from the viewpoint of the rural population, especially women who do live in the remote areas of the country, how particularly do you propose can we work towards improving their healthcare access?
Okay, so government has taken miraculous steps in this regard. There is increased availability of lady health workers at the rural areas. They go from door to door. Not only they provide polio vaccines, but they also do carry the reproductive health pamphlets along with them, and they also sensitize the families in areas regarding issues that can be tabulous for most of the society members.
Right. On which, sir, I'll come to you, and here we must talk about the challenges which either the healthcare organizations or healthcare professionals do face when it comes to implementing or adopting technologies, including AI, so to speak. So in this regard, from your own practical experience of working as a technology expert, what do you feel are the most pressing challenges in this regard, and how do you feel can we actually overcome the same?
That's a good question. So there are several challenges, and I think in countries, in developing countries like Pakistan and emerging markets, they could be in multiples as well. So biggest challenge would be, of course, the costing part, the cost part, because you'll need new hardware. You might, of course, for sure, would need a new software, but these still would be manageable. I think the most difficult and the challenging part would be the upgradation or upskilling of the staff, of the healthcare staff, of that needs to be done at a faster pace because the technology is moving forward much faster. So even if we get new hardware, new machines, or new software, but if the staff is not trained, if the healthcare fraternity is not up to date, they won't be able to leverage the benefits of this technology. So the number one thing would be the cost, and then of course the training of the staff. That's critically important. And then there are other issues, and one important other challenge would be interoperability, which means that all these machines and all these softwares and all the AI technology will have to talk to each other. So if I create some technology and you develop some technology, but if we both can't talk to each other, the end beneficiary, patient, or the citizen won't be able to benefit much. So I think all the systems need to be very interoperable. And that's where government regulations, standards, compliances, audits, checks would come in as well. So these are some of the challenges I see.
Definitely, sir. So this is something that we do need to work upon when it comes to improving laws and policies, when it comes to having better, perhaps, regulatory standards. On which I'll come to you, Muneeb, and here we must talk about the role of media when it comes to not only creating public awareness, but at the same time, in ways more than one, helping people access the healthcare system in a more effective manner, especially those who belong to the marginalized sectors. So in this regard, what contribution do you feel has Pakistani media made, be it electronic, be it social media, when it comes to bridging that gap, the common man out there with the healthcare system?
So the very fact that we're sitting here and talking about health and healthcare on national, television, I think that helps. But it's these small steps that need to be taken, and I think the responsibility does fall on the media to raise public awareness about health-related issues. Whether in English language as you're doing right now, or particularly our own local language and the other languages as well, from province to province. But other than that, I think that the right kind of conversation, not sensational journalism, but we need informative journalism to be shown on our TV screens. That is very, very important.
I agree.
And also to break the taboos. Things like mental health, I think they have been stigmatized. And also, diseases like HIV, even polio, which has led to a lot of stigmatization in our society. And I remember that during the COVID pandemic times, people would not even come forward and report and inform that they have been diagnosed with COVID, that they have
because
tested
there was so
positive
much
for
stigma
COVID,
around it.
that this is the kind of person we need to stay away from. So if we break these taboos, if people come forward and the media allows rooms and spaces for people to step forward to voice their own battles with various illnesses, I think that can help removing stigma.
So how would you comment on that, Dr. Saab, from the men's viewpoint? Because we do understand that not only men, rather the trans community in the country, they are also very prone to, rather willing to offer aesthetic treatment. So the societal pressures, they are equally impacting all genders.
Yes, they are. But I would like to add, Fatma, coming from the all the discussion which we've had so far, the solution at times is very simple, and we are making it complicated for no reason. When we were fighting the COVID time, I wrote a couple of articles at that time as well, and it was complicated for no reason. But my point is that put your resources where you're going to get a return out of.
So basically, in your opinion, sir, then we need to invest in primary health care to start off with. We need to strengthen that so as to be able to better incorporate, various technologies. Dr. Saiba, how would you comment on that? So how do you look at that? And you've also had that benefit of working in the public sector and in the private sector.
Okay, so in modern age and era, I think it is hard to deny the importance of technology in health. I am personally of the view that one should be open to the new innovations, specifically artificial intelligence, that has played miraculous wonders in research. Also digital health, wearable digital health devices and telemedicine, they have played their important role. Even the COVID area that we were talking about, where exposure and accessibility to the health facilities were restricted. At that time, telemedicine played its important part.
True.
And so, I think in this regard, we need to incorporate new courses and curriculum and modules in our existing curriculum, and students should be open to learning these opportunities and then implementing these opportunities so that there may be improvement in the overall health care system in our country.
Right, but then you see we go back to the basics, and on that I would agree with Dr. Saab. We need to ensure that everybody has that access to technology. If we talk about, we are just not talking about urban cities, madam, we are also talking about the rural and the more remote areas. People might not, in cases more than one, have access to basic health facilities too. It's a combination of everything. We need to take everything together in that yardstick. But Saab, I'll come to you in this regard, and I would want you to comment further, but from the viewpoint of being a technology expert. So when we do talk about issues like cybersecurity, when we do talk about issues like, data privacy concerns, we do understand that in cases more than one, these are serious issues which can be raised because of use of AI. So in this regard, how do you feel can we overcome these challenges? Because yes, we should ideally strive to use AI and various technologies so as to improve people's access to healthcare, but we cannot ignore the fact that this in itself comes with its own challenges.
In terms of cybersecurity, that's actually a big question, and that the reason it is big is because now technology is being used by non-tech people. So the technology has to be robust enough, and then the teams, as I mentioned earlier as well, that the staff has to be really, really upskilled, and that's critically important because when it comes to digitalization, the most important thing is safety and security. So there could be several challenges from data breaches. For example, data can be misused, abused, it can be stolen, and how would that be managed? Then there could be financial frauds in that case as well. Then there are issues of even developing the AI data models and algorithms, which could be incorrect, could lead to incorrect diagnosis. That's also a challenge. So that could actually impact masses. Similarly, if the hardware is not developed properly, if that is compromised in some way, that's another challenge. Then there are malwares, which is like the viruses and the malwares and the ransomware attacks, encryption and decryption of data, all of those things. Again, that's where the government policies, procedures, regulations, and standards will come in, but over-regulation is another issue. So I think all of this needs to have the right balance, which is critically important again.
But in addition to that, what about, sir, ethical considerations? Because we do also have to ensure that whenever we do use AI or various other technologies, this is done in a manner which is not only transparent, it is accountable for all.
Fatma, this is probably one of the most important questions. Of course, technology is important, and the hardware and the software and the artificial intelligence and the training and the data models and all of that part. But the ethical part to all of this, which is the non-tech part, is very, very, very important. And in Pakistan, we do not have that training, that part in our curriculum that needs to be embedded in our trainings, in our education, in our system. And that's very, very important. So transparency of data is an issue. Who has access to data? Who doesn't have access to that data? Those who have access, how can they use only for the professional purposes, and how not to use it for any personal gains or otherwise? how to remain fair and not being biased by any standard. So whether it is language, region, status of in the society, those things, segment of the society can impact. Privacy of data is actually another big issue. Who owns the data? How can that be stored? Who will store it? Who will maintain it? When to delete the data? And all of those. So we still follow international or US laws like HIPAA compliances, but we do not have any local regulations or guidelines to anonymize data, encrypt data, and all of those things. I think that's critically important as well. One more very important thing in all of this is the consent part, that we need to make sure that the citizen, the patient, is at the heart of everything, and he or she owns that data which is being used by machines. So a consent from that person is important, whether his or her data can be used for any data training AI models or not. So all of those things are very, very big questions, and they need to be debated, and they need to be highlighted, and they need to be trained both by medical staff, to the medical staff, and also to non-medical general citizens as well.
Right, sir, your point is noted. On which I'll come to you, Muneeban, before we conclude today's show. So, all in all, if we were to wrap up today's conversation, how do you feel can we overall strive to improve Pakistan's current healthcare system? That too, of course, adopting international best practices, but doing so in a manner which is unique and relevant given our Pakistani socio-cultural context.
The first guideline that we need to have recourse to is the sustainable development goals. And we need to make sure that there is a policy framework, not only just at a provincial level, which is very much, I think, the common phenomenon after 18th Amendment, but a national framework as well. And in that regard, a national health vision has been drafted, which is to be implemented by 2025.
2016 to 2025.
Yeah, exactly.
True.
Which is the nation, a national policy or national framework for health policy by and large. So I think that some progress needs to be made in that regard. I think that one of the biggest obstacle, as I previously said, are economic factors. We cannot have class apartheid when it comes to access to health, so that those who cannot afford private healthcare particularly are left at a disadvantage. With that regard, I think that an international best practice could be universal health coverage. And in Pakistan, we've had programs like the SARS program or the Sehat card or BISP. But other than that, I also feel that I think my co-panelists also talked about local healthcare workers, particularly women, and also enabling women to become doctors, to become practitioners, and also to have recourse to health care. And that stigma that women should not be able to step out or not be able to be treated by a doctor because of their gender. No, I think that needs to be removed, because it's access to healthcare which is of the essence. And also, I think that it's very good that today we've got artificial intelligence and information technology, website portals. So the thing is that we need to make sure that internet connectivity is also available in rural areas.
We need to get past that digital divide.
Exactly. So many levels on which so much needs to be done, but I'm glad that we're getting there.
Right. Slowly and steadily, but it is a very collaborative effort. We need to have hospitals on board. We need to have healthcare professionals like themselves. We need to have technology experts, and then also policy makers by that yardstick too. On which I'll come to you, Dr. Saban, before we conclude today's show. So, how do you propose can we bridge that gap which does exist between doctors and patients, especially those who belong to the rural areas in the country, when it comes to ensuring that yes, their communication is not only clear, it is effective too, because a lot of times we see that this becomes that very basis on which we see this level of distrust between patients and their doctors too.
Communication is very important in any professionalism and in any code of conduct for doctors. So it is mandatory part of training for doctors in both in the undergraduate levels, at the postgraduate level, and in the entry level as they enter as a supervisor by the College of Physician and Surgeon in Pakistan. So all the doctors, they undergo these trainings of professionalism and behavior sciences and communication so as to conduct a positive rapport with their patient. However, since medical errors are quite common, there are lots of factors that contribute towards the lack of professionalism in doctors. There may be overcrowding of the hospitals. The hospital staff may be overburdened because of so many pressures. And then there is some lack of mistrust and lack of communication on the part of family.
Madam, there are also language language barriers. A lot of times there may be people who may complain that they don't even understand the language or the very technical medical jargon which has been used by doctors so as to explain very basic things to the patients. So do you not feel that is also something which needs to be equally considered?
I agree, that is also a case, but what I want to add on it is the responsible role of media in improving or deteriorating any perception of public of their healthcare system. So media can act as partner to create positive trust, and so that healthcare providers can work smoothly with the community that they are serving.
Right, madam, your point is noted, on which I'll come to you, sir, and before we conclude today's show. So given the fact that you do have a vast, diverse experience, that too of working in various different countries, be it UK, be it UAE, or Pakistan currently, how do you compare and contrast the healthcare systems of different countries, and do you not feel that at a very basic level, giving people varying healthcare provision or varying healthcare services, that in itself is something which can very adversely impact patient satisfaction outcomes? Because, at some level, it is important to standardize all these, healthcare disparities too.
If you look at all the countries, the health systems and everything, you talk about the UK system, you talk about the US system. Now, interestingly, the highest per capita GDP contribution towards healthcare is US, but out of the developed countries, US lies at the 18th position. Now, yes, there is a budget needs to be allocated towards the side of future developments, and there the massive budget which has to be there should be going towards the rural side where primary healthcare is deficient.
True.
Okay. Now, tertiary healthcare. Now, in UK, when we were making a study over there, what they did was they centralized the cardiac surgery into 1 or 2 hospitals rather than opening up a cardiac surgery unit in every hospital. So putting up a whole cardiac surgery unit in every hospital means that you are putting a lot of resources into one area. So it's wisely putting your money.
You need to make intelligent use of your resources.
And
in a country like Pakistan, which already has limited resources, you need the right manpower to be able to do so. My last question to you, Badr Saab, before we conclude today's show. So when it comes to overall ensuring that we make use of AI, of technologies, but do it in a manner which is inclusive and accessible for all, how do you propose can we do just that?
Fatma, this is quite related to the ethical part, and the inclusivity and accessibility is also very important. Of course, we need to make sure that whatever new technology, hardware or software or data models are being developed, everyone has access to it fairly in the same way, and everyone is included. So I think that's where the development of software and hardware is important, that it is, so if the hardware or software is developed by developing countries in very established economies, it may not be very relevant to underdeveloped emerging markets or in areas where cost or price sensitivity is extremely high. So those things need to be taken care of. Language, not everything should be in one language. It has to have a multilingual interface so that everyone can understand how technology is being used for their benefit and what is being done. They should not remain in dark when technology is being used for their diagnosis or their treatment. So again, government standards and compliances, and that is where so there's a lot of onus is on the developing technology and companies, and also on the government as well. And that's where the community and the civil society comes in, and the patient advocacy and all of those things are really important in the ecosystem. And everyone has to ensure that everyone's concerns are being addressed and looked into, and everyone is being satisfied in that sense. So I think community partnerships are critically important when it comes to accessibility and inclusivity.
Right, sir, your point is noted. On which note, I would like to conclude today's show. Thank you so much, Muneeb. Thank you so much, Dr. Muniba. Thank you so much, Dr. Kamran. And thank you so much, Badr Saab, for your time today.
Ji, thank you, Fatma. Really appreciate inviting me. Thank you.
Well, to conclude today's show, we generally spoke about Pakistan's ever-evolving healthcare system. In this regard, we spoke about the healthcare issues, the healthcare accessibility problems. We also spoke about the healthcare disparities which do exist in our healthcare system today. If we are serious in overcoming all these challenges, then technology, then greater usage of AI is something that we very actively need to embrace. But in this regard, something that we equally need to be very cautious of is the fact that, AI does come with its own pitfalls as well. We need to ensure that we have not only safe but also ethical usage of AI, so to speak. Healthcare is a fundamental right of every person in the Pakistani society. It is the very cornerstone of social justice, and it is our collective responsibility as responsible members of the Pakistani society to ensure that everybody does get this right in letter and spirit too. Thank you for watching The Society. Until next time, take care and Allah Hafiz.